also try and see how we can collaborate in terms of exchange programs, try and benefit the population at large between India and Sri Lanka. So his visit marks a real landmark for clinical excellence in this part of the world to take this to the next level. I'm sure he will enlighten us in terms of how things are happening and what are the future for us to collaborate together between MGM and Sri Lanka government, whatever we can do. I think this is going to be a stepping stone and a milestone for all the institutes to look forward to from now onwards. This actually takes care of a few areas which is beyond, I would say, a normal collaboration. We are also looking at student exchange programs where they can come and learn from eminent faculties like Dr. Raja and the faculties available here in surgical oncology, medical oncology, BMT. They can cross-train themselves, cultural learning, clinical learning, and also research and development. So this is going to be a very different kind of a collaboration which we are looking at, and what we want the media to support this and take this word out that the science is going beyond boundaries. So we look forward to all your support and cooperation in making this even bigger. Thanks a lot for coming today and make this successful. Thank you.
Dr. Prashant and Dr. Urjita. And this is created as a one-stop solution for all cancer-related problems to offer holistic cancer care from prevention all the way to treatment and rehabilitation. So in that context, these two units which you have officially launched today mark very important milestones. Radiation therapy is something which you cannot undertake lightly in any institution. It requires a lot of resources, it requires a lot of infrastructure, it requires a lot of time to get it going. And we have the latest cutting-edge linear accelerator machine which is capable of all the various ways of very high precision radiation which are available today, IMRT, SPRT, SGRT, IGRT and so on. So this is a very important achievement by the management to help patients at large. The BMT, the bone marrow transplant unit, also changes the medical oncology department to a different level. Because first of all, unlike most of the medical oncology treatment, this treatment is a multidisciplinary treatment. When you have a bone marrow transplant unit, it automatically means that you have a good intensive care unit, you have excellent nursing care, you have an excellent high standard blood bank, high standard pathology. So it raises the level of multiple departments, because without that you cannot have a successful bone marrow transplant. So the fact that we are launching that officially today actually means that we have been successfully raising the levels of all these departments to this level where we can function at the highest standards. In fact, I am proud to tell you that under the able treatment of Dr. Gopinath, our consultant hemato-oncologist, please stand up, Dr. Gopinath. We have already successfully done 3 transplants. One of them actually an allo transplant, and all of them have been successful so far. In fact, highlighting the fact what I told you, it's not just theory, our department is up to scratch, and we are very proud that we have been able to achieve this in such a short while, because this hospital itself was launched only in January this year. We hope to achieve new milestones in the future, and the active collaboration plan by the management between Sri Lanka under the very eminent Dr. Kente Balavarthana and his team and us will be something which we look forward to very much in future, for a lot of collaboration at various levels, at academic level, at patient treatment level and so on. I thank all the press people for coming here. Thank you very much.
So there's nothing much that I have to say. But having said that, it is a real, I'm privileged and honored to be here, standing in front of you. And I consider this as an accolade to be invited me as the chief guest for this very important occasion. And, we are from Sri Lanka, and the connection between my country and India has been very, very long standing, goes back to centuries, and you are there always to help whenever we needed assistance. So I want to thank all the Indian citizens and your Prime Minister, Mr. Modi, and your Finance Minister especially, Madam Sitaraman, and other cabinet ministers, as well as all the Indian citizens, for helping Sri Lanka, because as you know that we are going through a bit of a heavy economic turbulence, and we would have been nowhere if not for the Indian credit line you have extended. So we are basically surviving on that, So I'm very, very grateful for that. So once again, I thank the entire Indian population, Indian administrators for helping us in an unprecedented way to overcome this situation. And actually, we are trying to look for some collaboration in terms of research, student exchange programs, as well as, because I'm a head of a university, so we are trying to initiate a student exchange program with your institution, and that will help us it will be a win-win situation for both countries. So, secondly, we are planning to help you all by supplying infrastructure for the organ transplantation program. Because I know there's a bit of a waiting list here. So that is one of the reasons that we are here, to see the possibility of providing infrastructure for your doctors to come down to Sri Lanka and to do the transplantation. I know a lot of foreigners will be coming for that. So it will bring foreign exchange for India, Sri Lanka, and more than anything, the patients will be benefited. So once again, I thank everyone for giving this opportunity.
As Harish Mani sir told, you people are the backbone for us for spreading the message to the public. So as always, you people have supported us in many ways. Actually, whenever we conduct any events, that reaches to all the public here. So you play a major role, and we need your support for cascading this information to all the public. Thank you.